Here to talk about the true politics of health care, former Republican Senator Rick Santorum and Democratic Representative and Senate candidate Joe Sestak. Good to see you, gentlemen.
Thank you.
Good to be here, Thomas.
Senator Santorum, the president today issuing a challenge to Republicans. He said, go for it, try and repeal this new health care law and see how the voters will fare come November. Should Republicans fear this challenge?
I don't think so. I think the American people have been very clear that this bill is not something that they wanted, that this was a takeover of the healthcare system by the government. No, Mr. President, it's not going to happen tomorrow. No, that we don't expect it to happen even before your election. That's how you drafted it. You drafted it to take place in 2013 and 2014, which will give us an ample opportunity to lay out to the American public exactly what this bill does, exactly how they're going to be affected, the average person. And I strongly believe, and I think the proof has already been in the pudding, that the American public do not want what the House and the Senate have just passed.
Yeah, you know, we really hear that challenge from both sides. Many in the GOP are predicting it will prove devastating in November for the Democrats who voted for it. Representative Sestak, who's really in danger of losing with voters here?
Well, the key here is, and that's a secondary issue, is are we helping working families? Look, my friend Rick voted against the Clinton health care plan in 1994 when he was a congressman. And since then, 10 million Americans have lost their health insurance. In fact, yesterday, as every day, 700 Pennsylvanians have lost their health insurance as Rick and his fellow colleagues say, stop, stop. So what's that mean? We lose $150 billion a year in lost productivity because of those uninsured. So what we did is add a savings to the deficit. By the end of next decade, saved $1.3 trillion, covered millions of Americans, 32 more million Americans, actually stopped the insurance company from its worst abuses, like denying my daughter, who had a brain tumor at the age of 4 years old. She's 8 today, but when she's 22, she can't get health insurance because she has a pre-existing condition. We stopped that nonsense in order to have more productivity from our workforce and actually a saved deficit. Let's hope we never go back to those days of 1994 where we stopped health coverage for everyone.
I want to give Mr. Santorum a chance to respond there.
Yeah, I would just say that what Congressman Sestak talked about, which is insuring more people, is something we should be doing. But that's not what this bill does. Sure, it provides some subsidies, and if you look at my record, Joe, you'll find that I sponsored bills to provide subsidies for those people who did not have insurance and was willing to spend the money to do so. But that's not what this bill does. It does that. But then what it does is lay government in charge, setting up an insurance system, setting up, moving people not to private sector. At least half of the people in this program are going to go on the Medicaid rolls. And if you look at Massachusetts, which has a very similar reform than what was just passed here by the Congress, the insurance exchanges that were set up by the Congress, same as set up by Massachusetts, haven't worked. And the fact of the matter is, almost everybody new coming onto the Massachusetts who are being insured are coming onto the state Medicaid payrolls. Right. This is going to be a very slow but gradual step toward government health care.
And stop going back and forth. You know, in sports, a team loses, you shake hands, you move on. Now we have become so bitterly divided among parties, hurling insults and making threats. I wonder if voters are going to be turned off by this whole political process.
Well, I personally think that's
my
what
response to that is that there's
vote was back then. Massachusetts is what they said is pox them both their houses down there. You two parties down there care more about politics than the working families. Do I think we need to work together more? Without a question. And have we become the Hatfields and McCoys down here? Without a question. But that also means sitting down and being able to reach across the aisles from both sides and being able to come together with a principled compromise, not a compromise of principle, as what happened when Ben Nelson grabbed his goodie bar and was almost extortion. Can it be done? I think with better leadership it can be done from both parties.
And you had a response, Mr. Santorum?
Well, I would say that I would agree with Joe. We need better leadership. And the leadership that we've seen so far has been strictly partisan. There was no attempt to include Republicans. There was no attempt to try to bring it together, and we could have. And I'm convinced that a package could have been put together, short of a government takeover, to insure more people and to reduce costs. And unfortunately, they decided to go it alone. They decided to just have the Democrats drafted and have them try to support it. And to me, that was an opportunity missed. And I think you're right, Joe. We didn't have good leadership. Good leadership would have made it bipartisan.
And we're going to have to leave it right there. I have a feeling this debate will continue. Former Republican Senator Rick Santorum and Democratic Representative and Senate candidate Joe Sestak. Gentlemen, thank you.